Page. I was a heart surgeon for 25 years, and I retired from the VA in Portland in December of 18, and I went home and I retired for 6 months. And my wife told me I needed to go out and get a job because she was tired of me being around the house all the time. So I wasn't going to go back and do heart surgery again. I found this little gig where I work a week and get a week off, and I thought that was a pretty good deal because when I was working at the VA, it was pretty much continuous. And so it's almost like I'm not working, but I'm still getting paid full time. I trained at Duke, and I also did, for 2 years, I did cardiovascular research. So I learned a lot about, I know a lot about the heart. This is my outline of the presentation. First of all, I'm going to tell you why it's important to know about heart disease. I'm going to tell you what a heart attack is, because a lot of people don't know what a heart attack is. Some people think a heart attack is just when you have chest pain or whatever. I'm going to tell you what the risk factors are, and then the majority of the talk is going to tell you how to prevent a heart attack. So heart disease is really important. As you can see, 1 out of every 4 deaths in the United States is from heart disease. More people are going to die from heart disease than from the coronavirus. It's the leading cause of death in men and women. And coronary artery disease, which is blockage of the coronary arteries, is the most common type of heart disease. I added this slide because the coronavirus started, is you're more likely to have complications from the coronavirus if you have heart disease. And actually pulled up from the CDC website, I didn't add it to my slides, but with regards to the coronavirus, the death rate, if you get the coronavirus and you have no health problems, and they don't know because they don't know what the denominator is, and there's a lot to learn. But this is on the website. The death rate, if you don't have any health disease, is 0.9%. The death rates by underlying conditions are as follows. If you have cardiovascular disease, the death rate is 10.5%. If you have diabetes, it's 7.3%. It's weird because the coronavirus is a respiratory disease, right? But chronic respiratory disease, if you have COPD or problems with your lungs, the death rate is only 6.3%. Yet if you have heart disease, it's 10.5%. And cancer, 5.6%. So I thought that was interesting. So first, a little bit of anatomy. The heart kind of looks like this. Sometimes it has more fat on it. We used to call it a butterball turkey in the operating room. But basically, this is what we're going to be talking about right here. This is the coronary artery. It's these little vessels that run on the surface of the heart, and they develop blockages in them, and you get a heart attack when one of those vessels gets blocked. As you can see, the heart is very vascular, but it's these big epicardial vessels are the ones that get blockages in them, and then sometimes we have to intervene. This is what a coronary artery looks like when it's normal. This is what a coronary artery looks like when it starts to get obstructed with a plaque. And this is what it looks like when you're having a heart attack. So when you're at this point, you're just having chest pain. Here you're having a heart attack. Here's another cartoon of the same thing. And then this one talks about here you have a blockage here, and then you develop a heart attack. So once you have a heart attack, that's not it. You can't just walk around and say I had a heart attack, because there's all sorts of complications you get when you get a heart attack. First of all, you can just die. And a lot of people die from a heart attack. But then the people that don't die can have a stroke, can get shock, can get congestive heart failure, can have heart arrhythmias, can have pericarditis. There's all sorts of bad things that can happen if you have a heart attack. And then you have to take care of those for years and years after you have a heart attack. So you don't want to have a heart attack. So what are the signs and symptoms of coronary artery disease? Well, these are the most common ones, and you'll see on the next slide that sometimes they're different for women. But the common ones that we always learn are chest pain with radiation. It's usually a squeezing pain, not a sharp pain, or not a pain that you get when you take a deep breath in. Sweating, nausea, shortness of breath. And the most important symptom is denial, because everyone will always say, oh, it's just something I ate. It's a little different for women, as you can see, that men are more conventional, whereas women will often they'll have an uncomfortable pressure or squeezing their chest, and it's number 9. They'll have unusual symptoms. So you got to be careful with women. That's a general rule. So we're going to talk about, first of all, why are we getting coronary artery disease? So the risk factors are high blood pressure, smoking or other inhaled toxins like air pollution, diabetes, abnormal lipids, high stress, sedentary lifestyle, and sleep apnea. I'm going to go over these risk factors, and then I'm going to go over them again and tell you what you can do to try to alleviate some of these risk factors. So first of all, high blood pressure can be caused by a lot of things. Some people, it's just hereditary. But for the majority of people, it's something that we're doing to ourselves. Either we're smoking, or we're not eating right, or we're overweight, or we have diabetes. And high blood pressure can cause coronary artery disease, and it can also cause an enlarged heart and cause heart failure, even if you don't have coronary artery disease. These are the blood pressure levels. It's, just to kind of give you an idea of what normal is and what the different stages of hypertension are. The second thing that we talk about is cigarette smoking. As you can see, back in the 50s, even doctors were promoting Camel cigarettes. This is what a cigarette has in it. It's got all of the household toxins that you have around the house when you smoke a cigarette. And I'm not going to go into each one of these, but basically, I'm sure you all know that cigarettes are bad for you. I don't think very many of you smoke. But what smoking does is it causes an inflammation in the blood vessel walls, and that promotes the atherosclerosis. The other thing that cigarette smoke does is it makes your blood more hypercoagulable, so you're more likely to form a clot. And then the nicotine in cigarettes, and also in vaping and people who dip, can cause vasoconstriction and vasodilation of the coronary arteries, which is a squeezing and a expanding of the arteries, but you can also damage the vessel wall. Air pollution, and I've actually heard the other day on the news, I heard Arnold Schwarzenegger talking about this, because they had him and the governor of Ohio, and they were talking about how air pollution causes disease, and it was spot on. Air pollution causes a lot of heart disease, even if you don't smoke, because it does the same things that smoking does. And it's really the particles that are less than 2.5 microns that you get with open burns and from factories that are the most damaging to the cardiovascular system. But other things that, just about any pollution is bad for the coronary artery disease. And as you can see, pollution causes a large percentage of the disease in a lot of the main organs in the body. And there's heart. 25% of the deaths from heart disease are from air pollution. So what do we need to do? Just support the government on things that promote, and we're in Oregon, so I mean, if I gave this talk in Alabama, they'd be like throwing tomatoes at me. So anyhow, all this stuff. You're supposed to don't have open burns. Try to use electric things. Try solar options. All the Green New Deal. All right, diabetes is. It used to be when I first started operating, that all the patients that we operated on, we were operating on them because they were smoking cigarettes. And then there was this big wave of diabetes 2, which is it's an epidemic in the United States. It's It's absolutely, the number of patients with diabetes 2 has gone, from 10% to 50% of the patients that have heart disease. And so now, diabetes is like the #1 reason why people have to have heart surgery. Diabetes really affects the heart. It increases your risk, as you can see on here, it increases your risk of heart disease by 2 to 3 times. And it contributes to all these other things that have to do with the heart. So the reason why diabetes affects the heart is because of how the diabetes affects the blood vessel. And it screws up the cholesterol metabolism. It messes with the cell wall. Diabetes, it basically really damages the coronary arteries, and it really promotes. I used to tell patients that the reason why you get coronary artery disease is kind of like farming, in that the blood vessels are a field, and if you have high blood pressure and you have diabetes and you have all these deals, it makes the field really fertile, and then the cholesterol can come in and grow. Whereas you can have really high cholesterol, and if you take good care of your vessels, you won't get coronary artery disease. But you have to have a combination of something that's damaging the vessels, and you have to have the cholesterol to form there. So it's one or the other. People can have real high blood pressure, but if their cholesterol is really low, sometimes they don't get coronary artery disease. Diabetes messes up everything. The other thing is cholesterol levels. And cholesterol can be familial or congenital. Some people just they're born with genes where they have high cholesterol. But I would say 90% of the high cholesterol is due to how we eat and how we take care of ourselves. And other things besides just food affects cholesterol, how we exercise and how we sleep, and our cortisol levels, and everything affects cholesterol levels. But if you do get your cholesterol level checked at your doctor, the lower the LDL, the better, and hopefully you can lower your LDL with how you take care of yourself. But sometimes you need a little help with pharmaceutical companies. So basically, the LDL is the bad cholesterol, and it takes the cholesterol from the liver and it deposits it in the blood vessel. And the HDL is the good cholesterol, and it removes the cholesterol from the plaques. So that's why you want to try to have a high HDL and a low LDL, and then the combination of those two is how it affects the plaque. But like I said, you got to have a damaged blood vessel for it to get in there in the first place. Stress. Why does stress cause coronary artery disease? The reason why stress causes coronary artery disease is because it raises your cortisol. And elevated cortisol levels is bad for your blood vessels. It increases your blood pressure, it damages the blood vessels. So high cortisol levels increases your blood sugars, it causes increased fat storage, it lowers your ability to fight off infections. So when you have stress, your cortisol goes up. When your cortisol goes up, then all sorts of bad things happen to you. So that's why stress is bad. This is the final one, and it's not a very good cartoon or anything, but it's a really good paper that shows that people that have sleep apnea are at risk for coronary artery disease. This is a study that shows that the risk of developing coronary artery disease if you have sleep apnea is almost as high as if you had diabetes. It's another risk factor. And I don't know, sleep apnea is something that has become more and more common as people have gotten heavier and heavier. And there's two types of sleep apnea. There's a sleep apnea that's just from being heavy, and then there's sleep apnea that you can get from your brain. But either one of them are risk factors for coronary artery disease. It's important to get sleep. If you don't get good sleep, it's harmful for heart disease. See, I drew this in here. I thought that was real fancy.
Oh, yeah.
Sedentary lifestyle. You know what they say? They say that sitting is the new smoking. People that have sedentary lifestyles and sit at their desk all day and work on their computer all day causes a lot of bad things. So it affects, not only is it bad for your back, but it's also bad for your coronary arteries. And it causes a lot of other things, missed work and all that. So that's why people are getting stand-up desks and taking breaks and going for walks, things you should do. We'll talk about that later. So the metabolic syndrome is something that I'm going to talk about, and it doesn't necessarily, it's not only does it make you increased risk for developing coronary artery disease, but it also can affect other systems, and I'm going to talk about them in a minute. But basically, metabolic syndrome is increased waist level, increased triglycerides, low HDL, high blood sugars, and it's pretty much an epidemic, almost a pandemic. Now I wanted to show this slide. This is NAFLD. Does anybody know what that stands for?
No.
Doesn't have anything to do with the heart. It's non-alcoholic fatty liver disease. So I just thought I'd throw this in because, as you can see, 25% of the population have fatty livers. And the reason why that's important is because after fatty livers comes NASH, or non-alcoholic steatohepatitis, and after NASH comes cirrhosis, and after cirrhosis comes hepatocellular carcinoma. So currently, NASH, or non-alcoholic steatohepatitis, is the leading cause of liver transplant. It used to be alcoholic hepatitis, and everyone thought the only way you got cirrhosis was from drinking. But now you're getting cirrhosis from eating bad and having a fatty liver. So it's something to think about. So this is one of my favorite cartoons, because this is what the doctors are doing here. You see, someone left the faucet on, and the water's going into the tub here, and it's going down onto the ground here. And so what are they doing? They're not turning the faucet off. They're mopping up, because that's what we have to do as doctors. We just give you pills, and we operate on you, and you keep doing what you're doing, but really what we need to do is just turn the faucet off. So, smoking. We're going to go through each one of these again, and I'm going to tell you what we could do. So, I know there's probably not a lot of smokers out here, but we've talked about how bad smoking is, and then to try to, it's kind of sad because it says these are activities that physicians are comfortable talking with their patients about, and you can see that the most common thing is referring a patient to have someone else talk to them about it. But really, we need the primary care doctors need to talk to their patients about quitting smoking. And then, the way we quit smoking is, there's nicotine replacement products, there's pharmacologic things that they advertise on TV that are very expensive. Some people just quit without any help. So I thought this was a great slide. At 12 hours, the level of carbon monoxide in your blood drops back to under normal. In 20 minutes, your heart rate and blood pressure are normal. In 2 weeks, the circulation to your lung function is improved. In 6 weeks, your energy levels are through the roof. At 6 months, you lose your smoker's cough, and your lung capacity is improved. And in 1 year, your risk of heart disease is half of that of smokers. Stress. We all need to do this every morning. Stress reduction is kind of what you whatever floats your boat. But you need to do something for stress reduction. Sometimes if you just wake up in the morning and just go out and close your eyes and breathe and do that for 2 minutes, that will be enough to help you. But there's other ways to reduce stress. Sometimes if your day's discombobulated and you get your day more organized, you'll be less stressful. But anyhow, it's a personal choice. But reducing stress is really important for your heart. So sleep is really important, and it will reduce your risk of heart disease, and it will also reduce your stress, and it will help you lose weight. I mean, it basically, it's kind of a cure-all. And I don't have any magic bullets to tell you how to get better sleep, but these are some suggestions.
Question.
Yeah.
Can I ask you a question? What do you consider eating 2 hours before bed? Is a thing of yogurt considered eating? Number one. Number two, does the thing of yogurt elevate your fasting glucose in the morning?
I don't know the answer to the fasting glucose part. It is considered eating, but I don't think eating a little bit of yogurt before you go to bed is going to disrupt your sleep.
Or a banana.
Yeah. I think they're all right with that. That'd be all right. And what they mean is that we used to have some neighbors, and they used to eat dinner every night at about 10 o'clock. You know, when you go to Europe, you go to Europe and they're all eating at 11 o'clock at night. It's got to be bad for you. All right, exercise. So exercise is kind of like sleeping. It does all these good things for you. It strengthens the heart muscle. It lowers your resting heart rate. It helps your lipids. Lowers your blood pressure. Decreases your body fat. Does everything. So it's good to exercise, and it doesn't mean that you need to join a gym and be doing heavy weight lifting and stuff like that. Just get out and do a walk twice a day. That's all you need to do. That's exercise. Just do something, kind of build. I tell my patients sometimes, just walk around the block once, and then in a week walk around the block twice. And just doing that will help you considerably. All right, now we're going to talk about food. Now, I'm not a nutritionist. But Socrates was, when was he? He was like 300 BC. He actually said this. So he was pretty smart. He probably knew we were all going to get type 2 diabetes and be dying from heart disease. So the first thing I want to talk about is intermittent fasting. It's kind of like the keto diet a little bit, but I'm not a big fan of the keto diet. I think these people that are eating bacon 4 times a day and avoiding all carbs, I don't advocate it. I admire them, but I don't think they're going to be able to do it. But you can, if you can just, I think if you could just have a goal of she was talking about eating right before she went to bed, but if you have a goal of maybe eating dinner at 5 o'clock and then not having anything to eat until 9 in the morning, it will help a lot of your profiles, your cholesterol profile, your glucose profile, and it will help with diabetes, and it can help you lose weight too. These are some of the prescriptions for fasting diet. So now we're going to get into food as medicine. And a lot of this started back around 2000. There was a cardiologist named Dean Ornish, and he wrote this book. And since he wrote this book, there's probably been about 3,000 books on diet. He was kind of the first. This is kind of the first fad diet. Now we're into keto diets and stuff like this. And his fad diet was basically a vegetarian diet. And the reason why he wrote this book is because he was a cardiologist and he was able to cath patients. And he did this study, and it wasn't that good a study because I think they only had like maybe 10 or 20 patients in each group. So, you know, scientifically it wasn't a very good study. But it was a really interesting study because they cath these patients and they looked at their coronary artery disease, and their coronaries were 40% blocked. And, you know, it was various coronaries, but their coronaries were 40% blocked. And that's not enough of a blockage to get a stent nowadays. It's not enough of a blockage to get a bypass. So basically you're going to treat these patients medically. And you randomize patients into best medical care plus their normal diet, or best medical care plus a vegetarian diet. And lo and behold, at 5 years they recath them, and the patients that were on the vegetarian diet, their blood vessels actually went down. So he was saying, well, you go on a vegetarian diet, you can get rid of your coronary artery disease. So he wrote a book. I'm not a vegetarian, just so you know. But this is a funny cartoon. So the heart surgeon says, for those of you who can't read it, can you all read that? Anyhow, he said we could do several bypasses and crack your chest open, and it'll cost $100,000, or we could put you on a vegetarian diet. And he says, gee, doc, that sounds pretty extreme. Another funny cartoon. These are my Alabama colleagues. But this is from, where's this from? This is from the USDA Economic Research Service in 2009, and this is what the United States consumes as calories as a whole in the United States. I don't know how they got their data, but you know, maybe it was on the census or something. But 63% of the food that Americans eat is processed. 25% of the food is animal. 12% is plant food. I don't know what the dark green versus the light green is. Isn't that amazing? 63% of the food that we eat is processed. It's not good for you. This was the food triangle from the 60s to the 90s, where they had bread and Cocoa Puffs and all this stuff at the base. That was the base of the pyramid. This was what we needed to eat, and then if you ate some of this stuff, it was okay. Now the vegetables and the fruits and beans and I think where's the meat? I don't even know if meat's on here. This is from Harvard Medical School. This is the healthy eating plate. So you cut a plate in half. And half the plate is fruits and vegetables, and then you got your whole grains, and then you got your healthy protein here. That's what they recommend. And then lots of water and healthy oils. So that's a good way to remember it. For patients that can't remember stuff very good, if we tell them that half the plate is fruits and vegetables, they can remember that. This is what we hand out to our patients at the hospital I work at right now. It's a very busy slide, but basically it says the same thing as that healthy plate. The one thing I want to point out is we try to encourage them to eat less animal protein. So heart-healthy fats, things like salmon and nuts and avocados and olive oil. Rich fiber foods. Most of the rich fiber foods are plant foods. Because how much fiber do you think a piece of chicken has? I'll ask this table over here. How much fiber?
Practically none.
Yeah.
Yeah. What do you guys say? Fiber in a chicken? What percent? 15? What do you guys say back there?
What the question is?
How much fiber is in chicken? What percentage? Meat doesn't have any fiber in it. All right, healthy lean meats. you know, pork loin and salmon and seafood. All right, we're moving on to another thing I want you to remember. This is hard to do. I've tried to do it. And for someone like me that doesn't have any willpower, it's hard to do. But less than 25 grams of added sugar per day. This doesn't count, like if you're eating fruits and they have sugar in them, that doesn't count. But I'm just talking about when you're reading the package, grams of sugar. So remember the number 25, less than 25 grams of added sugar per day, 25 grams of protein per meal, eat 25 grams of fiber a day, that's sometimes hard to do, and 25 pints of water a week. I had to figure something that was 25. That's 8 glasses a day. So this, I thought this was interesting because you know you buy these all these healthy protein bars.
Yep.
There's that healthy protein bar and it's got 21 grams of sugar. You're done for the day. But then you can have, what is it, 12 almonds and you're almost getting this much protein and no sugar. It's amazing how much protein there is in vegetables, but you got to eat a lot of them, let me tell you. Just look at this number here. So this is an interesting slide. So you got 100 calories of broccoli and 100 calories of sirloin steak, and that's 357 grams or 12.6 ounces of broccoli and a 1 ounce steak. But anyhow, I thought the numbers were, I mean, you can see broccoli's better for you than steak, just so you know. There's another cartoon. This is what a hospital meal looks like at most hospitals. Does that sound like anything I've been talking about? Not a lot of green on that plate. Anyhow, hospitals have been trying to do better. They've been growing gardens on top and giving them fresh vegetables, and then patients that can't afford food, they'll send them home with sacks of garbage, of vegetables. And we've been trying to do that in Alabama because a lot of our patients are really poor and can't afford good food. They usually eat most of their meals at McDonald's and stuff like that. So now I'm going to talk, the rest of my talk is going to be about, if you didn't listen to the first part of the talk and you get coronary artery disease, what we can do to help you. And it's going to be really quick because that's not the important part of the talk. But this is what we've been talking about so far is healthcare, and now I want to talk just a little bit about sick care, just to go over some of the meds that we put you on when you get coronary artery disease, and what we can do if you have a heart attack. So the medicines that we put you on if you have coronary artery disease is we put you on antiplatelet medicines, blood thinning medicines, blood pressure medicines, cholesterol medicines. We can stent your coronaries and we can bypass your coronaries. That's about it. That's what we do once you're there. And this part of the talk is a little more boring, but I just feel like I need to talk a little bit about what we do once you get coronary artery disease. So antiplatelet medicines are medicines that make your platelets so they don't work, and that's really important with coronary artery disease because when I showed those first cartoons at the beginning of the talk, where the plug was forming in the coronary artery, a lot of that is platelets at the beginning. So if you have an antiplatelet drug, then that plug won't form. Even if you have coronary artery disease, you can't get a platelet plug there. So I think everyone that's over 50 should take a baby aspirin because you just never know. But we give everyone that's got coronary artery disease at least aspirin, and then there's other platelet thinning medicines that are stronger like Plavix, and now there's the new Plavix. I can't remember what it's called, Brilinta. There's new antiplatelet medicines and the ones that they advertise on TV are the ones that are more expensive. Plavix is generic now, so they don't advertise it on TV. And then, so there's a difference between platelet inhibitors and then there's blood thinning medicines, which are called anticoagulants. And you say, well, they're the same thing, right? No, the antiplatelet medicines make it so the platelets don't stick together. The anticoagulants actually make your blood so it doesn't clot. So they're different. Sometimes we use them together. But the common things that we use anticoagulants for are people that have a DVT or a pulmonary embolus or atrial fibrillation or low heart function. And now they're giving patients anticoagulants after they've had percutaneous valves and even patients with coronary stents. Beta blockers are kind of the mainstay of patients with heart disease. They're the blood medicines that end with OLOL. And they decrease the heart rate and decrease the force of contraction and decrease the heart rate. They can have side effects. And then the ACE inhibitors and the ARBs are medicines that work with the kidneys to decrease the amount of work that the heart has to do. And the ACE inhibitors end with pril, and the ARBs end with sartan. So if you're on one of those are an ACE or an ARB, and they work in the kidney realm to make it so that the heart doesn't have to squeeze against such a hard pressure, and they're really good for patients that have heart failure. Calcium channel blockers are often used just for blood pressure, even in people that don't have heart disease. And they, sometimes we use them if patients have, these ones over here will slow the heart rate down, and these ones here are more just for blood pressure. And they, similar to beta blockers, they'll decrease the contractility, decrease the heart rate, and decrease the rate of the electrical signal through the heart. And then cholesterol medicines, there are all sorts of cholesterol medicines. These are the ones that work kind of, these ones on the top here work in the GI tract to either bind or block the absorption of cholesterol. This is a vitamin, niacin. And then, of course, fish oil will decrease the triglycerides. So those are some of the medicines, some of the simple medicines that we use. And then if you really want to get serious about heart disease, there's a little cartoon showing where they work in the gastrointestinal tract. And like this one blocks the cholesterol from getting to the liver. But if you really have serious cholesterol issues, then you get put on a statin. And statins have all sorts of side effects as well. But statins work really good, and when people have heart attacks, they all get statins. And then if the statins don't work, then they put them on these new drugs called, these ones are, I'm surprised these aren't on TV, but I haven't seen them. They're called PCSK9 inhibitors, and it's an injection you use, and they'll make your cholesterol zero. I mean, they work really good, but they don't usually give it to people unless the statins aren't working. All right, final two slides. This is a coronary stent, and this is what a cardiologist does. I was not a cardiologist, I was a cardiac surgeon. So basically you have a blockage and you go in there and you put a wire through the blockage, and then you blow up the stent and it presses the blockage to the side walls. And this stent right here will often have it'll be a drug-eluting stent, and it will elute some medicine so that it doesn't form, so that the platelets can't stick to it. But it won't let it form an endothelium. We used to use stents that didn't have that drug eluting, and so we could just put people on Plavix for a month or so, and then it would form its own endothelium, and they'd be fine. But now, when they have these drug-eluting stents that suppress the ability of the blood vessel to grow into there, they have to be on the platelet inhibitors sometimes for life. And then this is what I did, which was bypass surgery, where we open the chest and we sew a vein from the aorta past the blockage to an artery, or we use an artery that runs along your breastbone called a mammary artery, and we bypass the blood vessel on the front of your heart. And it's been shown that if you have multiple blockages, or if you have severe diabetes with a blockage in the LAD, that bypass surgery works better. But no one wants to have bypass surgery because no one wants to have their chest open. But generally, the bypass surgery is more long-lasting and works better if you have a lot of diseased vessels, or if you have diabetes. The thing about diabetes, when we first operated on patients that were just smokers, they would just have, it would be like this, they would just have blockages here. But now with diabetes, they have a blockage here, 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 they have a blockage here. You can't go in and stent all that. So what we do is just bypass the whole thing. So that's why bypass surgery works better on diabetics, because the diabetics have such diffuse disease. If you know, back in the day, before stents were, if we just had smokers now with this kind of disease, cardiac surgeons would be standing on the street, they'd be out of business. All right, one more motivational slide. So how do you stick to healthy habits? Sometimes it's hard. If you replace words with, like, if you replace I can't with I don't, like, I don't put sugar in my coffee, or I can't put sugar in my coffee. You should say I don't put sugar in my coffee. The crowding out method is when the kids are coming over, or the grandkids are coming over and they're having a big pizza party. You eat a big salad beforehand, then you're not so hungry for pizza. Just remember that, just make baby steps. You know, you walk around the block once, or maybe eat one less meal. Maybe one time when you go to the restaurant, you order a veggie wrap rather than having meat every time, or you just do little tiny steps, and eventually they'll grow into habits. And so you don't have to do everything that I said here. Just do a little bit of it at a time. And remember, it's the quality of what you eat that's much more important than how much you eat. So you can eat a lot of really good food rather than a little bit of bad food. So coronary artery disease and metabolic syndrome are common and lead to heart attack. And heart attack is, as I said, is the most common cause of death in the United States. Most of the risk factors for heart disease are preventable or can be eliminated. Make small steps in your lifestyle, and they're likely to become habit. Strive for a well-balanced, quality diet. Get consistent sleep, and stay hydrated. Do we have time for questions? All right. Yes?
What's the house?
That's a house up on Queen Anne Hill in Seattle. It's by where my sister lives.